Okay. So, but yeah, so Marley, this is for you. So to be honest, when you said swimmer shoulder, like I thought I knew what it meant, but I hadn't really heard that term before. But after doing like research and like seeing what it really means, it's pretty much the same, like synonymous with like shoulder impingement or like subacromial impingement is like what I would use in my world kind of. So we'll go into kind of like why it's specifically for like swimmers, but then also it happens a lot in the general population. And so John, this actually, some of this is kind of like stuff we've talked about before too.
All too familiar with the shoulder impingement.
Yeah, I was gonna say, it's hitting too close to home, guys.
Need me to take over at any point, just let me know.
Okay. That's my brother too. Yeah. Okay. So why swimmers? So I don't know, Marley, do you actually swim or just like you just?
I grew up swimming, actually. I did. I grew up swimming.
Okay. So like in general, obviously you're using like a lot of motion in the shoulder, but so the shoulder is designed to be the most mobile joint in the body and like the least stable essentially. And it has the most range of motion of any of the joints. And so it works well for swimming and like, you know, all the different strokes and things like that, but it compromises stability for mobility essentially. And so when you're swimming, obviously you're using all of that. And they like, I was seeing like that, like elite level swimmers can swim up to 9 miles a day, which is literally like 2,500 revolutions of like your maximum range of motion in one day. So that's crazy. That's just like,
that is crazy.
So much. I know. I was like thinking about the math. Like, cause like even like baseball pitchers and stuff sometimes get it, but that's like the amount is like negligible compared to that amount of shoulder motion. But anyway, so nope, that's not the way it works. I'm here to do this. Okay, so then I'm gonna kind of just go through like the different steps of like, oh, and just so I kind of revamped it from last time. So I'm not gonna necessarily, or I'm not going to go into like specific details of a study because I didn't feel like that was as appropriate or like helpful. I'm just gonna kind of, looked at a bunch of different studies, took what I thought was helpful and what you guys could use and just put it together. And so all the resources are at the end if you guys want to look at the exciting stuff, but I decided to change it up a little bit. So this is kind of like the steps that goes through to end up with like shoulder impingement or swimmer's shoulder and the pain of it. So essentially, because of like all the stress that goes on the shoulder over time, like the flexibility or like you get increased mobility of like that anterior part of the shoulder. So what I put in this little circle here. So it's kind of like path of least resistance type of thing. And so when you're trying to get, you're getting so much motion over time, that part of the capsule stretches out and gets like more lax. So it can be from like sometimes that happens to people just from like sitting with poor posture for a long time too, because it's just like a prolonged kind of different mechanism, but same end result. And so that puts a greater demand on the other things that stabilize. So the rotator cuff and the long head of the biceps specifically. So in this picture, let's see, your heads are on top of it. Oops. Okay. Okay. Here we go. Okay. So in this picture here, so like you can see this is like some of the stuff is taken off, but on the side, this is like the back part of the shoulder. So the rotator cuff stabilizes here and then the biceps tendon is here on the front. And so if the capsule is like loosened on this part, all of these things are just working harder to try to stabilize. And then what happens is, so essentially like they're working really hard to try to stabilize, and eventually if there's not like the muscles aren't turning on as well and all that kind of stuff, there's like a failure of the rotator cuff and the scapular stabilizers to keep the arm in the right place. So it increases the stress on the tendon. So in this picture, so here is like with the arm at its side, and there's like, so right here is this space where things can get pinched. And so this is what it typically looks like. And then when it's going up, because it's not stabilized as well, things aren't working like together as well. And so you can get this pinching at the top. So it can be a couple of different things that pinch there, but it's essentially, yeah, like everything's not doing its part and you end up with a lot of pain at the top of that motion, specifically in the transitional part from like this part.
Yeah, exactly. Literally, that is what hurts all the time.
Yeah. And so it's like at the beginning, the like way the muscles turn on a different pattern at each part. So it's like from 60 to 120 is like when it's like the most stressful for this. And so then it can be a couple of different things that get irritated, or all of them really. So it can be So you go up and you get that pinching. So it can be the rotator cuff. So there's 4 rotator cuff muscles. It's typically the supraspinatus that is the one that gets impinged, but it can also be the long head of the biceps or the bursa that can get inflamed, or you can get like a, all of them. So I thought this was a really interesting picture though. So for swimming specifically, you just use so many, it lists all the different muscles that are active during the different parts of this is just breaststroke. But so it has, those are pretty much every muscle that possibly could work in or around your shoulder. And that's just like one revolution. So 2,500 of them would be crazy. It's actually kind of like awesome that body does that for so long. I feel like after doing this little talk for you guys, I learned a lot. So it just, just kind of puts in perspective. So it would present kind of like you guys have said, so you can get the specifically, it's normally that pain on the front of the shoulder is like very localized, like right here typically. And then it can be all the way around the back. Like this little guy is how it could present because these are the muscles on the back that are helping to compensate, and the front is where the pinching is happening. So this is like a muscle guarding type of pain, and this is like a sharp pinchy type of pain. So this would probably be more like an ache if I had to guess. And then, so this is just kind of an example. So a lot of times, I guess with swimming, maybe you get it in both, but if it was someone that was like their dominant arm for maybe more like a baseball type of thing, you can have the shoulder blades look really different from the back. So the one that's like kind of tilted out like that. So that's telling us that the muscles that work to stabilize and keep the shoulder blade down are not really doing their part. So in this scenario, that right one would probably be the painful one. And you kind of can look how they are to midline, just kind of stuff.
Sorry to interrupt, but when I went and saw a physical therapist before COVID, he took a video for me. He had someone take a video, and he was just cupping my shoulder blade. He was trying to show me how much farther out. So this is just, you're blowing my mind again, just like last time. You're just blowing my mind.
See, and it's cool when you like, well, if you want to understand it, not everyone's that way. It's cool to learn it when you.
No, definitely.
Yeah.
Thank you.
Of course. Yeah, so there's like tons of these muscles here that like, this is the superficial, so that these guys are taken off on this one on the right, so they're all on both sides. So all of these muscles are helping to stabilize, and so they've just been working on overdrive. And then if you think about like an analogy that's maybe not very good actually, I'm going to just give it anyway. We're going to try it out. So you guys, like if you use a washcloth because you're like at your grandmother's house or something, unless you guys are really into washcloths, and you like go to wring it out and you get all the water out of it, and then you like leave it in that little wrung out like ball, and then you go back to use it, and it's like the crustiest little like wrung out ball ever. So that's kind of what the muscles on the back of the shoulder end up like, because when you're activating your muscles, it's like the water's in the washcloth, there's like lots of blood flow to it, and they're like healthy and happy. But when they're like stretched out, and it can happen from overuse from like actual swimming, or it can be from shoulder, like from the posture. It's almost like the blood gets wrung out of them, and then they end up like that crusty washcloth. So they get more knots in it, and they get like more painful. And so that's just one of the ways all this can happen. But that's
It was actually a very good analogy in my opinion.
Okay.
Yeah, super good analogy.
Taken from this, I don't want my shoulders to turn into crusty balls.
I know.
She definitely still uses a washcloth.
I have all these.
Oh yeah.
And I'm like, well, there's this crusty washcloth at your grandma's. That's pretty much what it's like. I forgot I'm recording this. Well, someone's going to watch back and be like, what on earth?
Jump in right at crusty balls. Well, no, I wish I wouldn't have worn like a T-top, because I want to do all those motions with my shoulders now, because I feel like I have some of that. It's just, I don't know.
Yeah. And it's totally normal to have knots. Like I know I do. Some people just carry their stress there more too. So it doesn't have to be like, I'm sure I could keep my muscles on more though also. So it's just something to think about. So, okay, you have shoulder pain, and now what do we do? So the main goals of treatment are to reduce the pain, control the inflammatory process, like strengthen, stretch, improve the stability of the shoulder, so those muscles don't have to do so much, help with the posture, and then return to, whatever your goals are. And okay, so the formatting of these next slides are a little bit interesting, because I took these exercises from different phases from an article, and they don't really all fit. So just, don't be too worried about that. So this is in phases. So for rehab, it's like you start in phase 1 and you go to phase 4. So I'm going to walk you through the different phases, just kind of like high level, but so specifically for like you, Marley, or something, like, so that if you can figure out where you are, and then what's going to be the most appropriate, and then you can like I can send you this, of course. So phase one is the very beginning. Like it just really started irritating you and it's like very painful and aggravated and like inflamed. And so the main goal at the very beginning is just to calm it down. So we're not trying to like increase your overhead strength or anything like that at the beginning, just calm it down. So in the boxes are some examples that they did in the study, but in general, we're trying to do like isometrics to start. So it's like these girls here on the right. So you're pretty much like pushing into a wall, holding like 50% of what you can, not actually moving, but you're turning the muscle on. So what that's doing is like bringing blood flow to the area. We're activating the muscles. It does strengthen it, but in a very safe way where you're not actually moving it. You can't irritate it, which also helps with like the little like receptors in the joint that tells your arm where it is. And so it kind of like helps to like create that brain body connection back together better. So internal and external, which is like what they're doing now, which let's see. So it would be like pushing this way, this way. Gotta figure out are definitely the biggest ones, but you can do all the different motions that the shoulder does into the wall. Okay, so phase two, and if you guys have specific questions as we go, feel free to jump in. But phase two is really starting to strengthen the muscles that are weakened. So this is really going to be like the rotator cuff, the scapular muscles, like the serratus anterior is the one that pulls the shoulder blade back against your body, and doing it more in like a single plane of movement. So these are some examples here. So my personal favorite, I'm so happy it was in this article because I stole it from yoga. It's like a modified cobra, but they call it Superman here. So I love this one because if you keep your hands on the table like that and you relax your head, I personally prefer head off the table versus like stuffing it into a towel, but you can't use your upper traps. And so the upper traps compensate so much for different motions of the shoulders. And so in that position, it's literally impossible. So especially, someone that's not terribly aware of their body, it's really awesome to do it that way. And it's just a good exercise. You'll probably feel like your shoulder blades turning on the way up and they kind of get like shaky on the way down, which is just like a weakness thing. But so most of these pictures here are really those shoulder blade muscles, but they're the ones that are going to help stabilize that. So because what's happening is the shoulder blade's ending up like going up forwards and then the arm bone doesn't move as well. So these are all going to keep the shoulder blade back. So prone extension, this little girl, yeah, so the T, all of these are pretty much, have you tried any of these, Marley? Did they have you doing this stuff?
No, they did not have me do any of these.
Okay. How long did you go for? Not very long.
I actually started, of course, the saying goes right before COVID hit, and I started probably in January and went like every other week through probably February. So not long enough.
Yeah. Yeah. And I don't know, kind of depends, I guess, where you were, which we can talk about more, I guess, once we get through. But yeah, so these are all, and you can use like, probably this is more like your standard PT, which I hate TheraBands because it's a personal vendetta because they, in terms of rehab, because they change with the resistance, with the range of motion. And so normally the hardest part of the motion is the end of it. And that's where the TheraBand is going to give you the most resistance. So it's just not ideal. Obviously, sometimes you just got to work with what you got. But so the internal and external with the band would be like that. Yeah. And then the ones at the bottom here are these ones that I put. Do you guys know what I think a push-up plus is actually in my next slide. No. Okay. So a push-up plus, do you guys know what that is? It's like a serratus anterior. I'm going to demo because
the scapular push-ups.
Yes, exactly. Because this is like what you would need to, like one of the things that's going to be good for getting the shoulder blades like back on the body. I can't wait for the time change. It's so dark. Okay. So essentially it's pretty awkward. So you're going to be here. And so the motion is going to be like, it's just coming from the shoulder blades. So my elbows stay totally straight. And you just like shoulder blades squeeze together and then you push up through your shoulder.
Yes, I definitely did this.
Okay. Yep. And so that is one of the ways that's going to help in terms of getting the shoulder blades like back on there.
Okay.
Had a picture of all of them, but not that one. So that muscle is like really the most important one for that specifically. Okay. So this is phase two. So then phase three, so we're just continuing to strengthen. And so at this point, that should be pretty, we're avoiding pain, not doing it if it hurts or staying away from that motion, but it's combining it in like more than one plane, essentially. So more functional and just more core stuff. So these were just pictures from some of the articles.
Was that woman blindfolded on all her exercises? What's going on there?
That's a good question. Your guys are over her face. What is she? I didn't get to that part. She's doing a body blade, which if you guys have never done that, it's one of, like, if I'm having a bad day, sounds so bad, and I need some entertainment, I have a patient do a body blade because like most people are so uncoordinated with it. It is hilarious. So it's like this thing you hold, it just like makes me giggle. I can't even help it. Like you hold on to it and you have to move it really quickly side to side. I don't even really watch Harry Potter, but it reminds me of those like Quidditch balls that fly. And so like, it's like you have to move it fast enough, otherwise the ball doesn't fly. And so they're like trying to move it like it's like a dead Quidditch ball essentially. But what this thing is that looks kind of like a sword. But it helps with like small motions. It's like perturbations. So it helps with like all the little stabilizing muscles. So I don't know why she's blindfolded though. Not sure about that. Maybe they're trying to hide her identity for these pictures.
Maybe it was like a proprioception exercise.
Yeah, but so things that are like weight bearing through the shoulder are going to be harder, but really good for it. So like if you were doing like planks or something, Marley, you would want to really be thinking about like pushing up through your elbows and like, so that's going to get those muscles. I guess you could do either way, but like focusing on either pushing up or kind of squeezing them together while you do anything that's like weight bearing so that you don't get any pinching. Yes, Lauren?
She's not blindfolded. Her face is just blotted out.
Oh.
That makes more sense.
True.
What were you going to say, Marley? Were you about to say something?
I did a lot of planks. I do remember doing a lot of planks and like trying to do the shoulder motion while doing the planks.
Yeah, I didn't know if like whatever program you're doing right now. I was just thinking of things that maybe you could incorporate to like whatever, I don't know if you're doing.
MBF, no, this is great. It was upper body day today and we had to do push-ups. So I will be doing these instead.
Yeah. And I guess I'm just trying to think like specifically with MBF, there's other stuff. I really like a lot of stuff she does though, because she actually does do like, especially at the beginning where it's like you let your shoulder like kind of fall forward and then you squeeze your shoulder blade back. So that's for that same muscle. I feel like most people don't really specifically target that. So I like that she does. But yeah, kind of more than anything, like thinking about where your shoulder is while you're doing the motions, like shoulder blade, like squeezing it back, probably like especially with overhead type of stuff. But so this is, and if you have any questions about specific stuff from it, you can obviously ask me. That was my elbow on the table. If you guys heard it, I did not fart. Okay, so phase 4. So it's pretty much same thing as phase 3, except you're really like trying to get as high level as possible before you go back to what you want to be doing. So whether it's swimming or like workout routines or that kind of stuff. So like, these are just more like intense examples that were in some of the studies. So like push-up position with your legs on a chair, or this is a wobble board, so like an uneven surface. And that would be hard, or like walkouts on a ball. So anything that's like uneven and your shoulders are having to stabilize is going to be good. And so, you know, all of these are putting more of the pressure and like we're kind of the theme is strengthening the back of the shoulder, right? That's where all those muscles really are from the beginning pictures. And that's how it's going to be more stable, because you're not going to tighten the front. I mean, I suppose the capsule could tighten, but it's not like that's not really necessarily the goal. Kind of harder thing to do versus just getting the muscles to do the work. So, and then speaking of cupping, yeah, that's all I got for you. But Michael Phelps, he uses all his muscles. That's why this is a funny example. And the cupping works very well, but because he's using all of them, that's why he needs it in that area. So I thought it was fun.
Interesting. Cupping.
There we go.
Can you explain a little bit what cupping does?
Sure. Well, I can try. So the cupping is not well researched. I did an entire thing in residency on that. So there's not like a definitive, this is what it does. However, I can give you what I found most like reasonably. So essentially it's, well, brings more blood flow to the area at the very least. So that's good for like tissue healing and that kind of stuff. But the idea is like with the circles and stuff that you get the darkest, the darker the circle, the more you need it essentially. And so it's getting like what's stagnant under the surface. So it's kind of like like under the muscle, like hypothetically, according to the people that looked at this, there's like waste almost that's under there that is not been able, like due to the trauma to that area, whether it's like intentional trauma like Michael Phelps, or maybe it's an injury and the muscles kind of working strangely. There's like stuff that hasn't been able to get back into the drainage system within the body, like so the cups bring the stuff to the surface, the stagnant material, which is like the dark part of it. And then that allows it to go back into like the lymphatic drainage system and get like recirculated through the body. So that's
it's like a plunger.
Essentially, yeah, there we go. I like that analogy. You're still at your grandma's house and now there's a plunger. But it really is. And so it's probably because a lot of the times when people have this, it's like those muscles aren't functioning well. Like, I mean, I think your body is pretty much designed to get rid of stuff like that, but this is like accentuates it. And so it definitely, lifts up whatever's underneath it. So I have like a picture of an x-ray of what's in it. And it brought up like the layers of like, the like skin, connective tissue, fat, and muscle, and it goes up into the cup. So the way Michael Phelps does it and the way I use it in the clinic is like I put it on and have them do functional movements. So if there's certain areas that are restricted, I'll have it put it on like the back of their cup, the back of their shoulder or something, and have them do the restricted motion. And so that's kind of like, essentially it's keeping what's in the cup pretty still, but moving what's underneath the cup. So it's helping to break up any adhesions between the different layers of like connective tissue and muscle and things like that. It's like the idea. But it works very well for increasing range of motion quickly, I will say. And
I had no idea.
Yeah.
Don't stare at the picture to the left too long, because it's starting, the more I look at it, the more it looks like somebody took Michael Phelps's head and posted it on somebody else's body. It's like really starting to weird me out like that now.
Yeah, like that. Like,
I will say just an observation, when my, sometimes when I feel like my back gets really tight, like once every couple of months, and I can't even move it at all, Mayor, like my neck side to side, based on that little pain chart you showed when you were doing that first example of the crumpled up washcloth, I think I might just been having shoulder issues. Maybe that's what you've been telling me, is shoulder impingements, because that little
oh, you mean your neck?
black and white guy, yeah, that you showed with those pain areas is exactly where I would get them.
Yeah, that's a facet referral pattern you get from meniscoid getting impinged. It's the same area, but it's from your neck.
Hey, Mayor.
Yeah. Hey.
I have a call at 4:30, so I have to leave.
Okay.
But
yeah.
Are you going to share this? Because this one is super relevant and accurate. I've been doing some of those exercises, but
yeah. Would it be, so I'm trying to figure out, so I'm recording this, so I guess I could stop and put the talking part, but anyway, I don't want to mess it up. Yeah, I can do that. I was thinking about just I'll probably just put them on my YouTube channel, and then I can put the link in my, I'll share it.
Okay.
Got to figure out exactly, but yeah.
Thank you, and see you guys later.
Right.
There,
and John, also there is I have the references. So if you want to go to the articles yourself, you can. They're all on Google Scholar. So
thank you.
You could probably put this in that link thing that you have on your Instagram.
I was thinking put it in the link tree, but I guess I could just go to the one. I was thinking that eventually there would be like a
folder of a bunch.
Yeah, exactly. But I forgot to record the first one, so it'll be a folder of one.
That's okay. It was a trial run.
Yeah.
Yeah.
This was like he said, this was spot on and super relevant. All the pain areas and the exercises, and I just need to keep doing them. I kind of just keep mustering through the pain and hope it goes away, but that's not obviously what's happening.
Gotta find a way to get it into your routine. It's hard to do.
Seriously.
Well, I think it could be as simple, I feel like so many times people it's either this or that, you're am I gonna exercise or do my PT exercises? But so much of this can be incorporated into the stuff you're already doing. And so I think it's more just okay, maybe you try these exercises, feel how it feels to turn on those muscles, and then how can I incorporate this into what I'm already doing? For arm day, or even the bottom ropes, for example, you can just do it kind of lackadaisical, but I when I was doing it the other, if you have the elbows at your side and kind of pull out, it causes your shoulder blades to activate so many muscles back there. And so that that alone would be kind of like rehab for you. But
Yeah.
you can kind of work it in, and like I can, yeah, talk to you more about specific ones in
I
there.
had not at all really thought about that. I just listened to what Megan says. I shut up and do it.
Well,
As you
that works too, but I just, get the most bang for your buck, I guess. And I'm always thinking about that. That's why I do it. But, how could I activate more muscles in this? Okay. Well, guys, you know how it goes. If anyone has any requests for next month, you guys get the priority. So, you think about it.
I'll be thinking about what's hurting in the next month. I'll let you know.
Yeah, I got
Seriously, thank you so much for doing that.
Of course. No, I actually learned a lot. It was good. I did not know how abusive swimmers are with their shoulders.
And the weirdest thing, I swear, I think I like really heard it. So I grew up swimming, but I think I really heard it one day when I was like reaching in my passenger seat to get my work bag, and it was just super heavy, laptop, water, lunch, everything was in it. And I remember hearing and feeling a pop, and then being like the rest of the day at work, like, oh, I just tore something. It's fine. It'll go away. And then it never went away.
You would be surprised how many people are reaching into their passenger seat or back seat to pick up something heavy, and that happens because you're like, it's like you reach and then you have to turn your arm to like pick it up, and that closes, like you're in already that maximum, and then when you do this, it closes the space, and then you're using the muscles. So it's like there's not enough space, and then you're using it. So if it was like eating tiny things ahead of time, that can definitely.
That's what did it.
Yeah.
If it's me, I'm usually in a rush. So if you're trying to do that in a rush, it's probably even worse.
Be careful. Be careful out there.
It's a scary world, man.
All right, guys. Well, thanks.
Bloomer shoulder.
And then
Thank you.
I actually have a partial tear. There's things you can do for tendon healing, but we don't have to. I can tell you. I can send you a message about that.
Maybe that could be next week.
Oh,
Or whatever.
that's true. But okay. All right, guys. Well, thanks for joining me. And I gotta figure out where I have to go to leave this meeting. Now I'm confused on what I'm in, but okay. Wait, how do I do this?
Thank you so much,
Yeah,
Meredith.
thank you.
Bye, y'all.
Bye.
Okay. I guess I do end recording, right?